What do immunosuppressants do for cystic fibrosis lung transplant patients? Imagine your lungs working hard to keep you breathing, but sometimes they become so damaged that a transplant is the only option. For cystic fibrosis patients, this can be a life-changing step. After a lung transplant, the body's immune system might see the new lungs as foreign and try to attack them. That's where immunosuppressants come into play. These medications are designed to gently turn down the immune response, so the body doesn't reject the new lungs. The main goal of immunosuppressants is to prevent what's called graft rejection. There are two types to know about. Acute rejection happens quickly when the immune system suddenly recognizes the new lungs as a threat and attacks. Chronic rejection, which can develop over months or years, slowly damages the lungs and can cause long-term failure. To prevent these, doctors often prescribe a combination of drugs. Calcineurin inhibitors like tacrolimus and cyclosporine are common because they help keep the immune system in check. Corticosteroids such as prednisone are also used to reduce inflammation and further prevent rejection. Sometimes, drugs that interfere with immune cell growth, called cell cycle inhibitors like mycophenolate mofetil, are added to the mix. For cystic fibrosis patients, managing these medications can be tricky. Their lungs are often prone to infections because of the disease itself. Since immunosuppressants weaken the immune system, patients are more vulnerable to infections, which makes balancing medication levels very important. Regular blood tests help doctors monitor drug levels to keep them within the right range. Patients need to attend frequent checkups to watch for signs of rejection or infection. Following the prescribed medication schedule carefully is essential for long-term success. Living with cystic fibrosis and a lung transplant also means taking extra precautions to avoid infections. Good hygiene, avoiding contact with sick people, and staying up to date with medical advice are all part of the routine. Healthcare teams work closely with patients to adjust medications if needed, ensuring the immune system is suppressed enough to prevent rejection but not so much that infections become dangerous. In summary, immunosuppressants are vital for helping lung transplant recipients with cystic fibrosis enjoy better breathing and a higher quality of life. They act as a shield, protecting the new lungs from rejection, but requiring careful management. Always remember, each person's situation is unique, so working with healthcare professionals is the best way to navigate this complex process safely. If you or someone you know is considering or has had a lung transplant, consult your medical team for personalized advice and support.